So without further ado, it's my pleasure to invite Professor Faye Johnston from the Menzies Institute and University of Tasmania to update us on findings from the early life follow-up stream.
Thank you very much, Michael. So I lead the part of the study that's following the health of young people, in fact, those who were in their first 1,000 days of life, starting from conception. So the people we've been following have included mothers who were pregnant during the fire smoke period, the children of those mothers who were not yet born during the fire smoke period, and children who were aged less than 2 at the time of the fire, and another group of children who were conceived and born after the fire, who've been our comparison group. And we've been learning about their health in 2 different ways, these 3 groups of kids. We have a lovely group of volunteer participants who joined us at the beginning of the study, over 500 children who completed a survey. And since then, we've done a lot of follow-up studies of children who've completed surveys, who've come for clinical checks, and some of them even offered blood. And that's the smallest little group analysis we've got, which is the 100 there. But most of our studies have between 100 and 500 children in them. The other stream is a data linkage study that includes all the children who were born in the Latrobe Valley over a 4-year period, including the mine fire. That's totally anonymous. We don't know who they are, but we're able to work out their smoke exposure and look at data like hospital data to find out how they've been travelling in terms of healthcare usage over the years. Okay, so I'm now going to go straight into our results. I'm giving you all of our main results from the study. Where it's highlighted in light green, that's a new result that I haven't yet shared with you in previous years. But just quickly to recap, the health of women who were pregnant at the time of the study, an important thing we found early in the study was that mothers who got exposed to more smoke had a higher chance of developing diabetes in pregnancy than mothers who had less or no smoke. And that was an important finding. It actually translated into around 16 cases that wouldn't have happened otherwise if it wasn't for the smoke. And their children tended to be heavier than children born to mothers with diabetes who didn't get a lot of smoke. So important findings there for diabetes in pregnancy. Okay, so now I'm talking about the group of children who were not yet born at the time of the fire, but their mothers lived through the smoke episode. And in this slide and in the next slide, I'm going sequentially because we've got new findings, but some of them relate to the first few years after the fire. So initially, we did see increased presentations to the emergency department for allergies or skin rash. None of these results were huge, but they were notable. We saw increased prescriptions of steroid medication, also known as prednisolone tablets, in the first 2 years after birth. And these are tablets mostly used for treating usually serious asthma or croup. It's a medication commonly used for allergies and asthma. 3 years after the fire, parents reported an increase in their children having minor respiratory infections diagnosed by their GP in relation to smoke. And we also checked blood vessel growth and development and stiffness, and that was normal. 7 years after the fire, we were able to check lung stiffness. They were too young to check 3 years after the fire, and that was normal at 7 years. We're still waiting for the vascular stiffness results. So this slide relates not to the children who were exposed when their mums were pregnant, but the children who were babies or infants aged less than 2 at the time of fire. And it's a slightly different spectrum of results, similar. In this group, we found a year after the fire, increased antibiotic dispensing to children who were more exposed to smoke than those who weren't. Increases in GP attendances in children who had more smoke exposure, and increased emergency department presentations for respiratory and infectious conditions. And that was all in the first year after the fire. When we looked at antibiotic prescriptions 2 years after the fire, again, we saw increases in prescriptions for antibiotics. 3 years after the fire, when children came to the clinic, we found increases, slightly stiffer blood vessels and slightly stiffer lungs. These were very small effects. We could see them statistically. They weren't effects that were likely to cause symptoms or changes in the health of the children. But the fact that they were there in kids who had more smoke exposure than in other kids told us that there was an impact, that children's bodies did respond to the smoke, and we could measure that 3 years later. The really good news was that 7 years later, that what we found in the lungs had resolved. There was no longer any blood vessel stiffness. And finally, we also looked at the effects of long-term background air pollution in the valley. And this is new and important work because we have found very similar range of outcomes: increased allergic sensitization to dust, increased GP attendances, increased antibiotic dispensing, increased attendances at hospital emergency departments, and hospital admissions for respiratory conditions and infections. And this hasn't been to a huge severe episode. This is in children who live in parts of the valley where there's slightly more air pollution in the background due to traffic or due to power station emissions than children where there's slightly less. And it tells us that ongoing everyday exposure is also important for children's health, and tells us that that's also an area for action to protect health. So what does this mean? And I guess the lessons from the ELF study so far are that it's important to protect against both severe extended smoke events, mine fires, peat fires, severe bushfires, in various ways: access to cleaner air, home infiltration, relocation if necessary, if it's going to be a long event. And it's also important to protect children's health with everyday air quality. And that's things that will be useful: using an externally vented range hood if you've got a gas cooker, not smoking around kids, even avoiding busy road if you've got a routine commute or exercise or walk you do. These little actions can have quite a profound protective effect on health going forwards. And I guess the final message is that for all these conditions, air pollution is only one of a whole lot of risk factors. It's a contributor. It's not generally the main cause. So the other important lesson is that effort and support in health generally, maternal and child care, antenatal care, young families, is just as important for protecting health, because you can't always avoid smoke events, but if you have the best possible care and start to life, you can manage them a lot better. So thank you. That's all from me.